Hello everyone, Ramadan Mubarak. I am Dr. Suhasini Gupta, Specialist Obstetrics and Gynecology in Amina Hospital, Ajman. Today we are going to talk about the female hormones, which is the most important in a female for maintaining her femininity. What are the female hormones? The most important female hormones are the estrogens and the progesterones. They are the predominant hormones. They are produced by the ovaries in the women, and they are the steroid hormones which are synthesized from the cholesterol in the body of the women. So estrogen is of three types: estradiol, estron and estriol. So estradiol is the most predominant one, which is produced by the ovaries. Estron and estriol is produced in a little amount from the fat and the adrenal cortex. In pregnancy, these hormones are being produced by the placenta. So let's see, when a woman is a small girl and she has not yet attained her puberty, what happens? There is a small region called hypothalamus in the brain which releases gonadotropin releasing hormone, that is GnRH, which stimulates further pituitary gland, which releases LH and FSH, luteinizing hormone and follicular stimulating hormone. What puberty is? Puberty is when the girl starts developing her secondary sexual characters and when the girl starts menstruation. At that time, this gonadotropin releasing hormone is released in pulses. That means sometimes it's released more, sometimes it's released less. And accordingly, LH and FSH is being released. So how this works? This all depends upon the phases of the menstrual cycle. So now the phase of the menstrual cycle is divided into two phases, the follicular phase and the luteal phase. So in the follicular phase, what happens is the estrogen level starts increasing. From there, LH and FSH get a positive feedback, and from there the follicles start developing. When the follicle reaches around 18 to 20 mm, this FSH and LH rises to a peak, and after the peak there occurs a ovulation. So in the market, the ovulation kits which are available, these kits, they detect this LH surge, and after the LH surge, they indicate you that you are about to ovulate within 12 to 36 hours. At this time, once ovulation occurs, the LH and FSH decreases as well as the estrogen decreases, and then starts our luteal phase. The luteal phase, which is of 14 days, as already discussed. So this it is predominated by the progesterone hormone. This progesterone hormone, this stimulates the endometrium to grow, that is the lining of the womb, and it stimulates the endometrial glands to proliferate in case the egg has been fertilized and there is a potentiality of the pregnancy. It prepares our uterus to hold the pregnancy. So if there is no pregnancy, the progesterone level falls after the 14 days and the menstruation starts. So now when the pregnancy happens, placenta that takes the function of secreting this progesterone and estrogen, and the progesterone is the hormone of the pregnancy which supports the pregnancy and does not allow the pregnancy to get aborted. Female hormones, they affect our fertility, they affect our menstrual cycles, and they have a very major role in the menopause also. But there is a good thing that these female hormones are not being affected by the Ramadan fasting. So you can continue your Ramadan fasting without worrying about your female hormones. Still, if you have any problem in your female hormones, you can visit your doctor anytime. Thank you. Ramadan Mubarak.